slice it and cut it.
There we go.
Okay, well, we'll go ahead and get started, everybody. My name's Daniela with the Fidelity Group. We're the broker consultant for the City of Macedonia. So at any time during this process, if you have questions or after today's meeting, feel free to, ask us. We're here to help. So as you know, as most of you know, we're changing insurance carriers for your medical starting January 1st of 2019. We're going to be enrolled in United Healthcare. Right now, everybody's enrolled in UMR, which is their self-funded side of the business. So we're going to be moving to the fully insured platform, and it's still with United Healthcare. So they have the same network of hospitals and doctors. So all of your doctors and things will be continued into the plan, but always feel free to just always check to make sure your doctors and hospitals are in the network. So a couple things is you'll be enrolled how you are currently enrolled today with UMR. So we're going to transfer everybody over to the new plan. We're in the process right now of doing all that paperwork. We will have you guys in the system within hopefully a couple days or so. And then we'll be able to get you some information that you can share if you have appointments the first week or second week in January. They will mail ID cards to your homes, so keep your eye out sometime in the next few weeks to look for that envelope with the United Healthcare symbol, because your ID cards will be in there. Okay, so a couple points. If you can, just remember to refill any prescriptions that you're currently taking through the end of this month, if you're allowed. I know sometimes you can't refill a prescription too early, but if you can, go ahead and do that. Because one thing to note, that the formulary of your prescriptions with United Healthcare is going to be changing. So we can kind of go through that now. So basically, we handed out this page here. So a couple things could happen. If your prescription that you're taking when you go to the pharmacy in January with your new United Healthcare card, your prescription could be changing. So it could either, a couple things could happen. It could either move to a different tier. So instead of it being tier 1, it can now be tier 2 or 3. Or it could require step therapy. What that means is that you can try, the United Healthcare wants you to try a couple other drugs before they will process and complete the drug that you want to take. So it's just, there's other, lower costing alternatives. So the third thing that could happen is it might require prior authorization. What that means is the doctor has to call in and verify that, the reasoning why you have to take that medication. The other thing that could happen is that drug is no longer covered, it's excluded from the formulary because there is a lower costing alternative available. It's not that that drug isn't available, it's just that there's maybe another generic form of that drug. It does the same thing. So those few things can happen. So that's why we provided you with this information here to look up your drug before you go to the pharmacy, because we don't want you to go to the pharmacy and realize that that prescription, you can't pick it up because it requires, a prior authorization or step therapy. So we just wanted you to be aware of those couple things that could happen.
And to piggyback on Daniela, this list is not all inclusive. We just took some of the most popular drugs that we anticipated, or drugs that we know that members are using, to try to give as inclusive of a list as we can. But do not assume that if you don't see your drug on this list that there are not changes to it. You're going to want to look them up and make sure of where they lie, so that you're just prepared when the time comes when you go to the drugstore.
Right, so there is a website here in blue that you can use before you're enrolled with United Healthcare. So that you can go on to search for your prescription. Or once you are enrolled, which will notify you, then you can call the number right there, the United Healthcare 1-800 number, and ask them. Right now, if you call, they won't see you in the system, so you can't call until you're actually enrolled, which again will be hopefully in the next couple of days or so. Okay, so anyone have any questions with those changes? Okay. So if you want to go into the plan itself, that's on page 4. So the medical plan is no longer an HSA compatible plan. So I know everybody today, or most of you, are on an HSA compatible plan, which allows you to, have HSA contributions from the City of Macedonia, and it also allows you to put away, pre-tax money into an HSA. That is no longer allowable as of January 1st. As of January 1st, this is the new medical plan that everyone will be enrolled in. This plan is called an HRA, Health Reimbursement Account Plan. So we can go through how that works, but first I want to go through the actual plan design. So as you'll see, the deductible, if you utilize an in-network facility, is $2,000 for single and $6,000 for family. Once you meet that deductible, by medical, prescriptions, whatever services you require, then the co-insurance you'll see is 100%. However, under this plan, there are co-pays after the deductible. So we'll go into the co-pays in a second. Under this plan, you have an out-of-pocket maximum of $4,000 for single, and then $6,850 per family.
But if you are a single in this room, the city is picking up $1,500 of your maximum out of pocket. So what that means is your HRA card, if you are a single, will be loaded with $3,500. I don't think there's anybody in here on a single plan, but just so that if you are taking information back to other employees, the single, we are picking up a portion of the maximum out of pocket in order for your exposure to the plan before it picks up 100% is $850 for a family, $500 for a single. Sorry, Danielle, I just.
No, yeah, that's great.
Thank you.
So how this plan works, like you said, is you have that deductible, whether you're single, $2,000, or whether you're a family, $6,000. So in the beginning of January, probably around the middle of January, you're going to get a HRA debit card in the mail at your home. What that will allow you to do is when you go seek services, you use that debit card to pay for your services. Okay, so at the pharmacy, when you go to the counter and get your prescriptions, you would use that debit card to pay for that prescription. Because pharmacy is always point of service. You pay when you get it or else they won't let you pick up the prescriptions. Now, on the medical side, when you go to the doctor or you get, have an MRI, testing, things like that at the facilities, you wait until they process the claim through United Healthcare. You don't want to pay at the time of service, okay? You want to wait till they send that claim through United Healthcare and it gets processed, and then you get an EOB back. Do you know what an EOB is, anybody? Good. So you want to wait till it gets processed, and then you want to wait till you get a bill from your medical provider and make sure it matches up, because doctors and hospitals are really quick to bill you, right? You want to wait until it gets processed through the insurance first. Then once you get a bill and it matches up, then that's when you would pay for that service under your HRA card.
If you pay up front, so in other words, if you go and you're having an MRI and the provider says you have a $2,000 or a $6,000 deductible, MRI is $3,000, we need you to pay for it. If you don't push back and say, no, I have an HRA plan, I have to wait, and you pay it, NEO will not reimburse you. You will be responsible to go to the provider, get that money back, and then you would have to provide it back to the employer, because once your deductible is gone, your deductible is gone. If you didn't manage it appropriately by waiting for that EOB and only paying what the insurance has allowed for that provider, you're going to have a problem. And NEO will not fix it for you. They were very clear when they were in my office a week ago. They will not reimburse. They will not fix the problem.
Okay. Anyone have any questions on how that HRA works, functioning, Yes.
Pam, just two questions. With the debit card, where's that gonna be from? Is that gonna be from like a Huntington or
I think
It's coming
Bank
from Bancorp.
Corp,
Yes.
Bancorp?
Yes.
Okay.
Yeah.
Right.
We're getting into the banking system now, and they will issue the card, and what will happen is when you use it for reimbursement, it'll just be an automatic transaction, and it'll come out of the city's accounts. Now, I want to kind of give everybody a heads up, we're in the banking system, we're kind of hostage to how quickly they turn around. That card could arrive around January 15th, just so everybody knows.
Okay.
Okay, we will give updates on a couple-day basis. I'm hoping earlier, could be a few days later. I just want to be open with you. Prepare for that. Now, in the event that you got to go get a $30 prescription, not a problem. You can actually, we'll supply some claim forms. As of January 1st, NEO will be set up to do reimbursements where you send in the EOB to them or the statement to them, and they can reimburse you for that. So I think we've got that covered as well as we can at this moment. But the cards will come to your home, so please, if you see something, the biggest concern I have is you will get junk mail. And you see something with return address as Bancorp, don't throw it away. Please, that'll be your debit card. And
It'll
there-
come probably in a very white generic envelope because they do that for the purposes of someone stealing a credit card or something like that. And I've seen people think that it's an advertisement and run it right through the grinder without opening it.
Yeah, you're
And
right.
it will be, your debit card will come in that same fashion.
Now, one of the things I want to highlight is there are restrictions built into the debit card. You can't go to the grocery store and buy beer. It just cannot, it's going to reject that proposition. But if you use the debit card to pay for services in advance, they're going to come back to you and say, we need a copy of that EOB to confirm that that's an eligible expense, because that's an IRS regulation. So just be aware. The best course of action to kind of emphasize is, like Annette said, hey guys, I have a HRA. I'll sign a statement that I'll be responsible, but I don't want to pay you now because I don't know what the carrier is going to allow for reimbursement. As an example, United Healthcare gets about a 50% discount. So they're going to tell you it's $2,000. I don't want you to give them the $2,000 because it's going to wind up being $1,000. And then now you got to go fight with the hospital to get the money back. So there's some, I want you to be aware of that and use it discreetly. And I have to tell you, very candidly, you go to the doctor and you say, hey, I got an HRA, we'll reimburse you, and he wants money now, I'd look for another doctor to be blunt, because they're all aware of high deductible HRA, HSA plans. They should be ready to work with you. And they will usually have you sign a financial responsibility note, which really says for any excesses that, like your deductible applies, you'll be responsible for it. So they're covering themselves with the ability to get the money. It's just they need to be aware that this will be, once they get the OB, you'll submit it, and you can call them and give them the debit card number and have them run it through. That's what we do. But in it.
How many HRA debit cards will come? So in other words, if you got 5 people on your plan, or you only have 2 people on your plan, if you have 2 people, will 2 cards come? Or if I have 3 children in college, do we know what they will be providing?
It's typically 2. Once these get out and you have a child over 18 in college, we could request a separate card. Well, you've got to remember, it's just like giving your kid a credit card to some expense. You got to use some judgment there. And I'm just saying, I gave my daughter, when she was 17, a credit card, and the bill came in next month, and she didn't think it was that much. But just be careful. We can request additional cards for kids out of state that pay for services. So after, I guess we should mention that in every meeting. If somebody has a child out of area in college over 18, you should probably let us know that so we could try to inform them ahead of time. And we would need the child's name as well. That obviously, that card would come in later than yours, but we'll go ahead and get on that now and address it. Okay. And if they come home with a new dress,
Something's wrong.
well, no, actually, the cards are restricted, but for anything to do with medical or prescriptions, it's covered. Am I saying that it's 100% foolproof? No, but you can't go buy groceries, you can't buy, there's certain things you can't buy.
So kids under 18 fall under my card?
Yes,
That
sir.
is correct.
And frankly, if they're like a Case Western or something, they can still fall under your card. I want to make sure that the parents are in control of what's going on. But if your child's at San Diego State, God bless them, and you want to get them a car to have access care, then so be it. We need to know that. Anybody over 18, I need to know the employee's name and the child's name and their age, and we can order additional cards. Because we can pull it off the eligibility file and order a separate card. Okay?
And my other question.
Okay.
Pardon me?
I have one other question.
Oh, go please.
With the HSA, we've been able through payroll to make payroll contributions into the HSA. But since the city is no longer providing an HSA, can we still contribute to an HSA?
No, because you
Okay.
have to have a qualifying high deductible plan in order to do that. So
Okay.
as of January 1st, that's no longer allowable.
Okay.
That's per the IRS guidelines.
I just want to make sure I follow the
Now,
guidelines.
the
So.
money
Right,
you
so-
have in the HSA, you can maintain.
Right.
Yes.
You can use it whenever you want to for medical expenses, or you can continue to keep it aside for later on retirement stuff. So there is no restriction for how long you maintain the account. You just can't add money to it.
Gotcha. Okay, cool.
Good question. Okay. So I just want to make sure everyone's clear how the plan works, deductible first, and then certain services require co-pays after the deductible. So for example, if you're someone on this plan who's a single person, you've already spent the $2,000, I go to the doctor, then I'm expected to pay that $25. And like Annette said, for the single folks, the there's additional reimbursement after that deductible for co-pays.
$1,500 for those folks.
All preventive visits are all covered at 100%, so there's no deductible, nothing owed by you as long as the doctor is, you're there for your preventive visit and they code it as preventive. It's 100% covered. Okay? So we really encourage everybody to go to their doctors, get their mammograms, get their colonoscopies, get your children's, well visits every year because it is a covered benefit under your plan. And then we talked a little about the prescription drug coverage. So you'll see that there's 3 tiers, 10, 35, 60. But again, that's after the deductible's been met. So again, the formulary is a little bit different, so just be aware of that. And then the contributions for the plan is over here on your page 5. So if you're someone that does not participate in the wellness, your contributions are listed to the left there. If you do participate in the wellness, on the right-hand side. Any questions so far? Is there anything? Yes.
If anybody's in the middle of some kind of a treatment now, and it's not gonna be concluded until after January, or is that gonna fall under 2018, or is that gonna fall under the new care for 2019?
Well, it depends on the date of service that you receive care is under which plan it falls under.
Well,
So,
if it started, but if something is, the follow-up is not until January,
yes, so if your follow-up visit is January 3rd or,
well, for date of service
mhm,
is in January.
It's gonna fall under the
the new plan.
Okay.
So if you talk about procedure, you're doing a follow-up in January?
Well, I've had a procedure that started already. I go to the dermatologist for surgery in January. And then I go to the cosmetic surgeon right after.
It's gonna be a new plan.
It's under the new plan because everything resets January 1st.
Because I haven't incurred any bills yet.
I understand. Now, there are occasions if the provider, I'm not saying that's an absolute answer, but typically it is. Sometimes if you're going through a block procedure, they'll bill it as one complete episode of care and dated at a certain time, like in December. It's gonna be how they bill it and the procedure code and the date of service that they apply. But if they break it out and bill it by service, it'll be the new plan in January.
So it could be a coin toss. Huh?
Pardon me, sir?
It could be a coin toss. Huh?
Yeah, depending. You know what, you could, I think what people don't recognize sometimes is the plan deductibles all reset January 1st. So that's why everybody's running to the doctor and getting things
Right.
done in November, December, because they met their deductible, so.
Question?
Yeah, could you just go over the contribution schedule? What is, so medical and prescription drug employee contributions per pay, 26.
Right, so you.
26 pays.
Right, correct. These are illustrated per pay. So if you're someone that does not participate in the wellness program and you're employee only, the
Well,
deductions.
okay, I'm gonna stop
Go
you,
ahead.
Daniela. You have to participate under our rules, which means you have to be at gold or platinum. If you participate and you're only at silver or bronze, then you're at the non-participation level. I thought we had asked Katie to make sure that we put the 10% and the 5%. The participation is in here
Right.
and what you have to be at. So if you are at a bronze or a silver, you're at the no wellness participation technically, because you have to be at a gold or a platinum in order to save on the insurance.
Okay.
And this is bi-weekly, every 2-week deductions
Out of the pay.
out of your pay. That is correct.
That's what I thought, I just wanted to.
That's
I
okay.
appreciate that.
And then page 6 just goes over how the HRA works. We talked about that earlier. It's going to be administered by basic NEO administrators. They're right here in Akron, so they're a local company. So, that kind of goes over the 2019 reimbursement schedule. Single coverage, the plan reimburses up to the deductible of $2,000, and then additional $1,500 towards co-pays. And then the family, the plan reimburses up to $6,000. And then the family will have an out-of-pocket expense of $850. Now keep in mind, these are all for in-network services only. So United Healthcare obviously has a large network. I mean, you're familiar with using the plan for the past, 2 years, so. And then page 7 just goes over all of the different preventive services like we talked about, age-appropriate screenings and exams and things that are all covered at 100% under the plan. And then page 8 is the dental plan. This is with Humana. We just put a brief summary in it just to have all the benefits in one spot here. So if you have any questions on how the dental plan works or have any, questions for that, just let us know. And then also the vision plan is with Humana. Again, we wanted to provide all the benefits for you in one spot here. So there's no changes or anything, but the reason for the meeting is to really go over the medical plan to make sure everyone understands how that works, because it's changing from the current to today.
And we'll, even though the Humana hasn't changed, will we get new cards for the,
Oh, that's a good question. Will Humana provide new cards, or they'll probably just stay?
There's no changes.
There's no changes, so your
No.
cards will remain the same because there are no dates on them.
Right.
So that is very true.
It's an interesting question, because a lot of dental providers today don't even give you ID cards anymore.
Right.
So I would believe that you're not gonna get a new one.
Right.
You can always request a new one if you lost yours.
But we can, with the Humana website, I can go on and print a paper copy
Yes,
of
you
your
can.
cards at any given
I
time.
just didn't know if, in the past we had, is it still good? I mean, if it's still good,
It's
I'm
still gonna be good. So if you do have 2 Humana cards. One will say dental on it and one will say vision on it. So you have to make sure that you have them both, because if you try to hand them a Humana vision at the dentist office, they're gonna look at you kind of strange, or vice versa.
And then the city also provides life insurance for every employee who's actively working. It's basic life insurance and AD&D, so every employee does receive $50,000 of benefit paid out to the beneficiary of your choice. If there are any changes regarding a beneficiary, please update your beneficiary form with Annette, because that's super important. We'd hate to have something happen and, you know, there's no beneficiary in file, or it's just the wrong person, so.
Now-
Uh-huh.
I'm waiving the city's medical insurance, but I do opt for like the life insurance and I have,
You
that-
can maintain the.
Yep, yep, that's separate.
okay.
What's nice about this too is it has accidental death and dismemberment. So let's say, you know, someone does pass away due to the result of an accident, it gets paid out double, so it's now $100,000. And this also includes line of duty benefit for police or fire. It pays out twice the ADD benefit, so that's a nice enhancement too for family members. You also have the opportunity to purchase your own additional life insurance on top of what the city provides. That's listed on the bottom here. So let us know if you're interested in that. If you didn't already sign up when you were first hired or when we had the true open enrollment, it does require evidence of insurability. So they do make you fill out, you know, medical questions if you want to enroll now and you're not currently enrolled.
Is this open enrollment time for that?
No, it's not. It's just if you want to join, you can, but you have to go through those medical questions. Yeah.
Anything above the 50,000 that we offer.
Okay, so we can sign up anytime?
Mhm.
Yeah, well,
Because
We don't
I
wanna
was told
say-
December, so that's why I want to I waited till December.
no, you can't sign up for the optional life anytime during the year. It's what Daniela is saying, that in your initial time to not have an evidence of insurability is time of hire.
Right.
Now, if you sign up anytime after time of hire, which we say open enrollment,
Okay,
and, which is now, you sign up, you still have to go through the evidence of insurability for any optional life.
okay.
When you come in at time of hire, they give a guaranteed amount of 50,000 that you don't need to do an evidence of insurability. But after that initial date of hire, it's open enrollment, and then you have the evidence of insurability questionnaire.
Is that something where you have to go to the doctors and stuff?
No,
You
no,
just fill out
no,
a questionnaire?
no,
Okay,
we have access to it.
okay.
You fill it out, they'll send it to you as well. What happens is you'll come in my office and you'll do the enrollment form. They'll send you information, you don't fill it out, they deny the coverage. So you have to watch, even though I will do the enrollment form, you're going to get something in the mail from Lincoln asking those evidence of insurability questions.
Okay, so we can do that this month, December.
All this month.
Okay, perfect.
And then the wellness activities here, and the wellness programs on page 11. Like Annette said, if you qualify for the gold or platinum, you get the wellness discount. So the information is listed there. Complete one health risk assessment, or, you know, you go on the app, get your biometric screening, and then a verified workout, so. Any questions on the wellness plan? Right. On the last page, page 13, we provided all of the contact information. Like I said, United Healthcare's information is there. Their website is there. We also have the link to their website for if you're not currently enrolled with them yet. Go on that website to locate the different prescription programs and, you know, check your doctors and hospitals and things like that. But like I said, once you get in the system, you'll be able to call United Healthcare and they'll be able to help you with any type of questions and things regarding that. All right. Is there anything that you wanted to cover in that?
Not unless anyone has any questions. I mean, that's the gist of the program.
Just one thing to reiterate, please, next week you'll be live, we'll be able to give you PDFs of your ID card before the 1st with United Healthcare. Actual hard ID cards will follow in the mail shortly after, but you can access care with that PDF ID card, and we'll get that to you. I'll work through Annette to get that done. And keep in mind, you'll have coverage effective 1/1. But I would like you to go out after, say, 26 next week, verify drugs, medications, to see if there's anything you have to have the doctor do. Sometimes the step therapy isn't appropriate, and the doctor will have to call in, or it's to say you have a drug that's not covered, because everybody's formulary changes 1/1, even the one you were on now changes. I just want you to go out and check to make sure your drugs are covered, you do everything you need to do before you go to fill it. The thing I don't want to have happen is you're at the pharmacy and finding out you have a problem. Okay, so if there's any questions there, we'll help you know what you can. And the other thing, we're working as hard as we can, I just want to let you know, your debit cards will be, we're shooting for the middle of January. If they come earlier, great, we'll look at updates as we go. And I would suggest any of you have prescriptions due, if you can fill them before the end of the month, and we'll go from there. If there's any challenges or any concerns, let Annette know, and she'll engage us to help.
Now, with mail-in prescriptions, we need a new prescription from the doctor?
Yeah, for mail order.
Yes. Mail order?
For mail order,
Yes.
good question. Retail script they can fill, no problem with your card. Now, if you fill it before the 15th, you'll pay for it and get reimbursed. If you wait till the 15th, you can use your debit card to pay for the script, okay? So, yes, good question. But
Yeah.
mail order has to be the drug that changes, and this is industry practice. Just call the doctor's office, say, hey, I need a new 90-day script. We'll get supplies to Annette for the mail order program and get them out so we can do that. Very good question. And I want people to not have disruption. Anytime you have a change, there is some disruption. And we're just trying to do our best to keep the costs down.
Do you know if there's a budget factor as to how soon the pharmacy can refill some of those prescriptions? Early?
There is, it varies on the drugs. As an example, narcotics, no. Certain
Typically
pills.
3 days,
Yeah,
typically 3 days
Yeah.
on most things.
yeah. Yeah.
Is the earliest they could renew them?
3 days prior to the renewal date. Now, that might move a little bit, but in all my years' experience, I have not seen anything more than 3 days.
Yeah, that's probably a good answer. You know, very candidly, if it's a small drug and you pick it up, it's $30, you can pay it, I'll give you the form to get reimbursed. I've had some people say it's $300, as long as I get reimbursed in a week, I'll do it. But that's why I want to make you aware that we're trying, it may come earlier. I'm not gonna build a fake picture here, like fake politics or whatever, but the reality is, we're hoping to have these things earlier than the 15th, but the 15th is the target date. Outside of that, if there's any other questions anyone has? All right, thank you very much, and again, if there's issues, bring them to net, we'll get involved and engaged. Thank you. Thank you, everyone.
Thank you very much.
Thank you.
Thanks.
So, I got a form filled out.
To waive.
Back to the life insurance. I have additional coverage?
No, I thought they denied yours. I need to go look because they were waiting for medical information that they didn't get. I need to look, come up to my office and we'll look again, we'll look at the bill.
Okay.
I believe that, let's look, because I had a couple people, they denied you, then they approved you, and it was kind of a mess. So let's look, and if we owe you anything,
Thank you, guys.
obviously we'll submit to Patty.
I'll get
I
that.
can't read, but I want to say that sometimes they deny initially, and
Okay.
then y'all get to do the paperwork, because I don't
Thank
ever
you.
see it. And then they approve it, so we need to look on the bill to see if you have additional coverage.
If I maintain, let's say they approve me and I maintain the additional coverage, does that still allow me to receive the stipend for not collecting medical?
Has nothing to do with the medical, we don't contribute towards the life.
Gotcha.
So,
Okay.
we pay for the first 50,000, anything additional we don't contribute towards. They are separate from each other.
Okay, and what
Once
was,
you reach 70, you're maxed out. You don't have to worry about it.
with what runs
He
in
has
the
a little
family?
ways to go.
With what runs in the family, I hope I get 70. So, and then what was it, do you have to know what the cost was? I was on a more expensive plan. What was that cost me paycheck? Do you know what I'm saying?
No, you were in the PPO plan, I don't know it off the top of my head, but you get $150 a month
Okay.
for stipend.
You're welcome.
Yeah, so-
I want to say you were 107 bi-weekly.
Okay, so 200 a month.
Yeah.
Okay, so then I'm gonna
Plus,
see like a,
plus you're going to
January
see the 150 on top of
So like
that.
350.
So you're gonna increase by about $350 a month, I would say.
Okay.
Although your withholdings for your insurance is under a section 125, so it was pre-tax. So it wasn't gonna feel like $100 and some dollars.
Right,
So if you wanna be safe, I'd say $90. So that 90 bi-weekly, so
So
180
100
increase plus 150 for the stipend.
Okay,
That's
so
what you'll increase by.
it's about a wash with the wife's insurance.
Is it?
Yeah, but like with hers, it's a pain going to
There you
Metro.
go.
They're-
You'll have your ID card, that's not the problem. They're
But
gonna see a
it's
deductible, do you have family coverage?
So
They're
it
gonna
was
see
kind of one of those, we knew what we
$6,000
had, I think-
And they should
didn't want to
process
stay
it
with
and you
us,
can pay
with
it.
what we had.
The issue is you're probably not gonna have a debit card at that point in time to give them any money.
Yeah,
And you take the documents we gave you.
all right, so I give this
And
to
they
you
should
now?
process, you'll see
I
the
would prefer you
financial
stick it under my door, because I don't want to
responsibility.
lose it.
Yeah, so they should
I
be no
got-
problem.
I'm not
with it.
going
Oh, you know what, let me.